Imagine knowing exactly what you want to say, but being unable to move your mouth correctly to produce the right sounds, even though you can move it just fine for things like eating or brushing your teeth. Imagine how frustrating that contradiction must feel. That's what people with apraxia of speech experience every single day. Apraxia of speech, also called speech apraxia or verbal apraxia, is a disorder in which people lose the ability to plan and coordinate spatially and temporally the movements needed for intentional speech production. And it's not caused by weakness, paralysis, or sensory loss in the speech muscles. The American Speech-Language Hearing Association, ASHA, officially defines it as a neurological speech disorder that reflects an impaired capacity to plan or program the sensoromotor commands necessary for directing movements that result in phonetically and prosodically normal speech. There are two types: acquired, typically after a stroke, tumor, or any kind of brain lesion, or developmental, usually seen in children and known as childhood apraxia of speech. In this video, we'll focus only on the acquired subtype. If you're interested in the developmental form, you can check out our separate video on that topic. It's important to tell apart apraxia of speech from two other conditions it's often mistaken for. The first one is dysarthria. In dysarthria, the problem is with the speech muscles themselves; they may be weak or even paralyzed. In apraxia, the muscles are perfectly fine, the difficulty is in planning and coordinating how to use them for speech. In fact, a person with apraxia can move their speech muscles without any problem. For example, if you ask them to open their mouth or stick out their tongue, they can. But when you ask them to speak, they can't do it correctly. The second one is aphasia. The main difference between these two disorders is that aphasia happens when a part of the brain responsible for language is damaged. This affects language, the cognitive side of communication. This includes thinking of words, recalling them, understanding language, both spoken and written, and organizing words correctly. In contrast, apraxia only affects the ability to plan and coordinate the movements needed to speak. Apraxia of speech is almost always linked to damage in the brain's language-dominant hemisphere, which is usually the left side. The lesions that cause this condition are typically found in the inferior frontal gyrus, the insula, or the supplementary motor area, all regions involved in motor planning and located near Broca's area. Learn about Broca's area here. This condition has distinctive speech features that make it easier to recognize. The first one is inconsistent errors. The main thing that sets apraxia of speech apart from other speech disorders is that errors are inconsistent, meaning the same word can be pronounced differently each time it's attempted. Second, groping for sounds. Another key feature is that the person may visibly struggle to position their mouth correctly, often unsuccessfully. This slows down their speech and disrupts the natural rhythm, stress, and intonation, making it sound flattened or off. Speech length. They also have difficulty with longer or more complex words. The longer the word, the harder it is. If this video is useful, please subscribe for more content. And the last one is an automatic, voluntary dissociation. One of the key features of apraxia of speech is that automatic or unplanned speech is often much easier and less effortful. People usually speak more clearly in natural situations than in artificial ones. For instance, saying, "see you later," is usually easier when they are actually leaving than when a clinician asks them to say it in the middle of a session. It's also easier for them to produce phrases and expressions that come almost automatically, like counting, reciting the days of the week, naming the months, or saying the alphabet. Here's an example of a person with apraxia of speech.
They talk to me like I will a normal co-worker like that.
It's very common for apraxia of speech to co-occur with other conditions, Broca's aphasia. This is quite common because the lesion often occurs near Broca's area. According to some sources, at least 72% of patients have some form of aphasia. Dysarthria, at least 29% of patients also have dysarthria. Limb apraxia, this can occur if the damage extends beyond speech-related regions, although it can also appear in isolation.